importance of health and wellness in every aspects of life. Myself, Abu Bakr, Head of Partnerships and International Business at Apollo Hospitals, Bangalore, truly excited to be here with all of you today to discuss the cutting-edge healthcare initiatives we are driving at Apollo Hospitals, Bangalore. We are committed to a mission that closes to our heart, touching 1 billion lives and ensuring the world-class healthcare is accessible to everyone, regardless of location or economic status. At Apollo Hospitals, Bangalore, we don't just deliver care, we are constantly pushing the boundaries of medical excellence to offer specialized treatments, advanced technology, and compassionate care to our patients. Our focus is not just on healing, but also on reaching every individual with the right care at the right time in a manner that is both effective and affordable. Today, we are proud to highlight some of the key technological advancements that are transforming healthcare and improving lives. These include our work in heart failure management, robotic surgeries, precision oncology with CyberKnife and proton therapy, and our focus on minimally invasive surgeries for brain and spine conditions. These breakthroughs are empowering us to provide a level of care that meets international standards, helping patients recover faster, experience less discomfort, and regain their quality of life in ways that were once unimaginable. Now, I am thrilled to introduce some of the leading medical experts from Apollo Hospitals, Bangalore, whose passion and dedications make these advancements possible. These are the professionals who, day in and day out, ensure that our patients receive the best care available. Dr. Satish Satyanarayan, Senior Consultant Director of Neurosurgery at Apollo Hospitals, Bangalore. Professor Sridhar PS, Lead Consultant in CyberKnife, Proton Therapy, and Senior Consultant Radiation Oncology. Dr. Jayanti Tumsi, Lead Consultant Oncology and Robotic Surgeon. And I have Dr. Praneeth Surya Devara, Consultant Interventional Cardiology and Heart Failure Management. Each of these distinguished experts embodies Apollo Hospitals' commitment to advancing healthcare with both skills and compassion. Before I hand over to my esteemed colleague, I want to take a moment to express how thrilled we are here to be in Maldives. The natural beauty of the islands reminds us of the importance of not just physical health, but the holistic well-being of every individual. The Maldives offers a sense of balance and peace, which aligns perfectly with the care and healing philosophy we practice at Apollo Hospitals. We are proud to be expanding our reach globally and bringing the very best of our healthcare solutions to places like Maldives, where we hope to collaborate and contribute to the growth of healthcare in this beautiful region. Once again, thank you all for being here today. We are excited to share more about how Apollo Hospitals contributes in transforming healthcare with the help of advanced technologies, compassionate care, and a commitment in making world-class healthcare accessible to everyone. Thank you. I would request everyone to have a look at what we do at Apollo Hospitals in the form of video. Thank you.
Apollo Hospitals Bangalore is one of the most trusted hospitals offering high quality and comprehensive medical care. At Apollo Hospitals, healthcare goes beyond our four walls and it starts the moment you enter. We provide world-class healthcare to our patients. Our state-of-the-art technology, supported by internationally trained experts around the world, is the testament to it, treating with minimal invasive approach and robotic-assisted procedures. Our Center of Excellence each institutes synonyms with personal care and attention to details that makes Apollo Hospital South India's most trusted hospital. We have a dedicated international patient desk and lounge. Our team provides in-house interpreters, travel desks, and prioritize doctors' appointments. Inspired by 5 strong pillars in its pursuit of excellence, we are here to bring you a warm and seamless healing experience at Apollo. It is a picture of reassurance. Welcome to Apollo Hospitals.
Thank you so much. Let me request Dr. Satish S to share some of the insights on neurosciences department.
Thank you very much, Abuji, and greetings from Bangalore, Apollo Hospitals. I represent the Department of Neurosurgery, and my name is Dr. Satish, and I have about 30 plus years of experience in the field of neurosurgery. We are excited to be in your wonderful place of Maldives, the land of beautiful beaches, serene atmosphere, and natural beauty. Even though we have been here for multiple times, it always gives us a new opportunity to come and explore newer places. And also we are very thankful for the wonderful hospitality by the kind people of Maldives. We have traditionally been treating a lot of Maldive patients from last 2 decades, I would say, since the hospital has started. And a lot of expatriates from here, Maldivians, actually live in cities like Bangalore, where they may be studying, etc. And this gives us an opportunity to see their parents, their kith and kin, etc., who have medical problems. At Apollo Hospitals, Bangalore, we are proud to say that we are one of the leading centers as far as cutting-edge neurosurgical work is concerned. As you all are aware, technology rapidly is changing, and this is very difficult for smaller hospitals or centers to keep up with, because what is state-of-the-art a couple of years back will already become obsolete. So we are very proud at Apollo Hospitals, because Apollo Hospitals, being one of the top corporate chains and which started the corporate culture in India, is leading, and it's always in the forefront when it comes to technology. For instance, the Apollo Proton Center in Chennai is the only one of its kind in Southeast Asia, which provides high-tech care for difficult to treat tumors and cancers in the body. At Apollo Hospitals in Bannerghatta Road, we have state-of-the-art operative theaters, diagnostic equipment, and the personnel with neurosurgical operative rooms, as well as in the neurosurgical critical care unit. So we work on a 24/7 basis, because as I was coming to Maldives, I was realizing that the second most common cause of mortality, even in Maldives, just like in India, is actually stroke. Now, stroke is a devastating condition which can affect the brain generally in people above 40-50 years of age, but can also affect people, even children, as young as few years old. Now, this, once it happens, unfortunately, there is no remedy for it, in the sense that the patients may never go back to their normal life. So the most important thing is prevention, and the second most important thing is to be able to reach a hospital which is stroke ready within few hours after the event has happened. So this is very, very important, because once the patient reaches the hospital, one has to take care of what is known as thrombectomy, which, if it is done in time, can save lives. Now, in the absence of such advanced facilities, patients will end up being hemiplegic or paraplegic for life. This is just one instance to show that the hospital has to be always ready and up to date in technology. We also have a very comprehensive brain tumor treatment center within our premises, and my colleague Dr. Sridhar is one of the leading specialists in CyberKnife, which is a very, very advanced technology which helps to treat even the smallest and most difficult to reach lesions in the brain. So as far as operative neurosurgery is concerned, we have a semi-robotic operative 3D microscope. We have the latest endoscopes. We are also helped by intraoperative neuronavigation and very advanced technologies which few hospitals have, like OARM, which will guide us to actually do very, very safe surgeries. And we can actually verify the position of the implants even before the wound is closed, which otherwise would have been detected later. So if any corrections are required, or if anything less than perfect has happened, one will have the opportunity to correct it. Now, these kinds of advanced equipment will help us make brain and spine surgery extremely safe. Also, the importance of other collaborative departments which makes the surgery safe cannot be undermined. Now, being a multi-speciality hospital, we have the privilege and the help of working with other departments, which is very important given that the patients are now rapidly aging. We see patients who are above 60 and 70 years of age with multiple comorbidities, which means that unless they are worked up properly and made safe for surgery, it is difficult for those patients to otherwise get very good outcome. Apart from complex spine and brain surgery, we have also a program now we have started for deep brain stimulation for patients with advanced Parkinsonism whenever they are suitable for this. We have a very good pediatric neurosurgical program as well, which caters to children below 12 years of age, and we have good pediatric intensive care as well, which will take care of them in the post-operative phase. Apart from that, we are a recognized level 1 trauma center, so complex polytrauma, sometimes which patients come from air ambulance from different states of India as well as from other neighboring countries because of the comprehensive way that they can be given care. Apart from this, we have cerebrovascular surgery. We have a very good neurointerventional facility with a biplane cath lab, which helps us to do interventions in conditions like stroke, aneurysms, AVMs, etc. So to summarize, it's not just the technology which is important, which is in its own way has its own importance, but equally important is the personnel behind it. Not just the doctors and the nurses and the caregivers, but everyone working as a team will be able to help get the best outcome. So most important is the human touch, which Apollo is always been best known for. A very friendly atmosphere, the ambience in the hospital, the personnel who have that human touch and empathy with the patients. And that's why the patients from Maldives love to keep coming back to Apollo hospitals whenever their dear ones have an issue which is complex and has to be treated abroad. It's our pleasure to keep treating you people and interacting with you all. Thank you.
Thank you so much, sir. I would request Dr. Sridhar PS now to share the insights on CyberKnife and palliative care pain management.
Thank you, Abu. Good morning, everyone. I am Dr. Sridhar PS. I am a radiation oncologist and a lead consultant CyberKnife in Apollo Hospital, Bangalore. So I'll be representing an oncology as a whole. So I'll start with what is happening in the oncology field first, and what all the treatment options available. And we are also looking at why this is happening so much. So that's one of the questions I was asked actually when I was going to some place in Maldives. So that's actually, it makes a food for thought. So oncology as a overall has taken a big turn. Actually, if you see, the number of cancer patients across the world is increasing, and Maldives also we are seeing one of the most common cancers, the most common non-communicable diseases, that is to be in the cancer. Most common cancers, what we are seeing is in the breast cancer, especially, that definitely Madam is going to explain more about that, especially in the young. So we are seeing around 45 to 50 triple negative breast cancer. These are some of the technical terms. So where the importance of screening becomes very, very crucial in these people. And another one is liver cancers, and the prostate cancer is also on the rise, and tobacco-related cancers, which is very, very important even in Maldives. And then comes the treatment part of it. So I always insist the first time is the best treatment. So you need to be like, whenever there are symptoms which is tells about the possibility of cancer, it may be loss of weight, there may be lump, or it may be like not able to eat properly. So definitely you need to contact your doctors, and that will tell the proper investigation is required. The diagnostic front, the proper biopsy and doing a molecular testings makes a lot of difference, and accurate diagnosis is one of the things which is very crucial in terms of the treatment of cancer is concerned. And then accurate staging. So we usually call it as a PET-CT one-stop staging, which makes a lot of difference. Either is it a really early stage or it is advanced stage. According to that, definitely we can take a proper actions. So oncology and in our Apollo hospitals, each patients are discussed in a multidisciplinary team approach, where there's going to be a diagnostic, that's a radiologist, nuclear medicine specialist, pathologist, the surgeons, medical oncologists, radiation oncologists, psycho-oncologists, and including the technologists are all the part of the treatment. So, and of course the patient and the caregivers are also part of decision making. So that makes a lot of important in oncology, because to make out, it is not only the treatment part which is important, it is how to make a plan for the roadmap for the future. That makes a very crucial in terms of oncology treatment is concerned. So the surgery and medical, now we are looking at very high precision treatment. So we don't want it to extend and make it like the more of a morbidity. So the smaller the better, and the multimodality treatment is the key. So the radiation part makes it important in case of any oncological treatment. Probably 85 to 90% of the things, any patients in their lifetime will require radiation. So it may be in terms of early cancer as a radical intent or a curative treatment, or in terms of an adjuvant where we wanted to add on treatment to the either post-surgery or along with the chemotherapy, or to reduce the tumor and make it operable. So in combination, we call it as adjuvant or neoadjuvant treatment. And even in the end stage, or where the patients cannot be treated, at least let's make them pain-free or symptoms-free. For that, what we call it as a palliative treatment. So all the three can be included in the in terms of radiation is important. So radiation is a technology-driven the area where technology makes a lot of difference. That is where the infrastructure, and that is where the Apollo is forefront in that, where we are talking about high precision radiotherapy in terms of CyberKnife, or it may be proton beam. So we are always there to serve the people. So my forte is in terms of radiation is concerned. So we are having a new CyberKnife, that is a robotic radiosurgery system. So where it is robotic assisted. Normally radiation is given for like 5 to 7 weeks of radiation, usually like 10 to 15 minutes, 5 days a week for 5 to 6 weeks. That is called conventional radiation, where we give a tumor plus the extra margins, that is called to take care of the microscopic disease. And the main problem with that, the motion management and the extra spill of radiation which occurs to the normal structures. Whenever we are giving radiation, 2 points we always remember. We need to give radiation exactly to the tumor and give as less as radiation to the normal structures. When you give high dose to the tumor control is better and the outcomes are better. When there is radiation to the surrounding structures are given less, treatment-related morbidity or side effects, what we call it as, it decreases, or to the extent it becomes no treatment-related reactions. So in CyberKnife is a robotic-assisted, very pinpoint, highly accurate, continuous tracking systems what we use it. And because of that, the high dose is given only to the tumor, and the surrounding structures probably we don't give extra margins. Because of that, the treatment-related side effects becomes very, very less. So this is only around 15, like the maximum of less than 30 to 35 minutes. And where all the treatment, what all the types of patients we give in this type of one, the brain tumors, that's what Dr. Satish was telling about that. There is a combination of treatment sometimes. There are patients where the surgery is done, there is a residual tumor, where we don't want to completely remove it because it may cause a neurological deficit. So what we call it as a planned treatment or a safe resection, maximal safe resection, and then go and treat the area effectively with the CyberKnife. And there may be patients where may say that I don't want radiation, I don't want surgery, or inoperable because of medical reasons or surgical reasons. These are the patients we can treat very effectively with CyberKnife, up to 5 fractions, sometimes only 1 fractions to 5 fractions. Some of the benign tumors like pituitary adenoma, schwannomas, we treat very effectively. AV malformations, that's the vascular tumors, we treat very effectively with CyberKnife. and there may be like functional conditions called trigeminal neuralgia and gelastic seizures can be treated very well with very effectively with CyberKnife. Then comes the lung tumors and the head and neck tumors. In lung cancers, which is also very common in case of Maldives, then elderly people where there's an early cancers vis-a-vis with surgery, where the patient does not want surgery or not able to consider for surgery, the CyberKnife acts very well, where we are looking for a curative intent. So most of these early cancers, we are looking for the more than 95 to 98% local control, so that it's a long-term survival is better. It's what we call it as a curative intent. Then there may be patients where there is a the lung with the lymph nodes, or the patient has completed the chemotherapy, there is a tumor still present, we can treat very effectively in terms of lung cancers. Even in lung cancer with the metastasis, what we call as oligometastasis, the treatment is very better with CyberKnife. Liver cancers, where the HCC, where the transplant is not possible, the early cancers, liver cancers can be treated very, very well with CyberKnife. Pancreatic cancers, and where the pancreatic cancer is one of the deadliest tumors, we call it about 3 to 6 months is the survival. With the effective treatment with the CyberKnife, we are seeing more than 95 to 98% local control, and to the extent of more than 3 years survival in this subset of patients. And prostate cancer. The prostate cancers, a lot of times, that is what I've seen in this part, and the aging population is more, and there may be genetic preponderance also. And we have seen treating the prostate cancer effectively with CyberKnife is very, very crucial, because the main advantage is there is no open surgery in this case, and that makes a lot of difference, and is only a one-time treatment, is only like maximum of 5 fractions, and even if it is spread to the locally or into the other parts of the bone, we can treat very effectively with CyberKnife, including those affected areas. In our case, in our series, even in a stage 3, stage 4 cancers, 10-year survival, we have seen around more than 75 to 80% of the things in case of CyberKnife. There's other advantage with CyberKnife is there may be patients who are already treated, tumor has come back. We call it as re-irradiation. CyberKnife scores better than any of the treatments. And then comes the function, as I already told you about, the patients does not, it may be treat the pediatric tumors to the elderly patients. Sometimes there is no anesthesia is required at all. Sometimes who cannot lie down, we usually give a short course of anesthesia. There is one more treatment available, what we call it as a proton beam therapy, which is like where we treat very effectively only the tumor. After particular time, after particular area of the interest, the radiation dose becomes 0. Where some of the pediatric brain tumors can be treated very effectively, chordoma, medulloblastomas can treat very effectively with CyberKnife, even re-radiation, and some of the lung cancers and the hepatocellular cancers, prostate cancer can be treated very well with the proton beam therapy. So to conclude, actually, there's a very effective treatment available for cancer. Do not think that you have a cancer and that is the end of the road. So definitely there is a very good advantages, and the newer techniques in combination of immunotherapy or the other things, we are seeing definitely better results. Even in stage 4 cancer, what we call it as oligometastasis, our aim is the patient should survive minimum of double digit, that is more than 10 years, with a good quality of life. That makes a lot of difference. And I'm happy to announce in a short period of 100 days in our CyberKnife, we have completed 100 patients, which is going to be one of the record. And it's a teamwork. I really thanks the whole of the team, the oncology team, and the Apollo management for this. Over to you.
Sir, can you also share, can you also throw a light on proton beam therapy?
Yeah, I explained. So the proton beam therapy, technically a different the type of radiation. When we talk, we are talking about X-rays, is a linear accelerator. Here is a proton beam is one of the things what we use it. It's a unique thing is, say the proton beam as a physical advantages where the linear energy transfer, technically it is a very effective type of radiation. Wherever the radiation is given, there is a chances that the tumor control is going to be very, very high. That is for the tumor, wherever it is there. And the entry and the exit, in a normal radiation, there will be a little bit of extra spillage. Here, in terms of proton beam therapy, because of it is the physical nature, the entry point is only the radiation dose occurs. After particular one, after the Bragg peak, where it releases a full radiation, after that particular point, the radiation dose becomes zero. Because the radiation dose becomes zero to the normal structures, actually the treatment-related side effects becomes the nil, practically zero. So, and one of the things is the pediatric brain tumors. Treatment-related second malignancy is one of the worrisome in case of radiation, because X-rays is also the risk factor for cancers, and that is practically not there in case of proton beam therapy. Chordomas, brain tumors, as I told already, hepatocellular and prostate cancers is very effectively can be treated with proton beam therapy. And I forgot to talk about one of the things in even cyber art, where we can give high dose of cyberknife radiation as an ablatory dose to some of the arrhythmias, where there is triggering factors which is there as a part of the cardiology. Thank you.
Thank you so much, sir. I invite Dr. Jayanti to speak on breast oncology and the robotic surgeries in OncoCare.
So thank you very much, Abu. Good morning, everybody. It's a great pleasure for me to be here in Maldives, a very, very beautiful country with beautiful people here. I am Dr. Jayanti Tumsi. I'm a lead and robotic surgical oncologist at Apollo Cancer Center in Bangalore, which is in south of India. So today I thought I should address a few of the women-related problems which are extremely prevalent in Maldives. As I understand, amongst the cancers, breast cancer is the commonest cancer occurring in Maldivian women as also in India. But surprisingly, though the incidence of breast cancer is very high, it is an extremely treatable cancer. Yes, breast cancer can be cured, it can be treated, the outcomes can be extremely good, provided the disease is detected early and it is timely and properly treated. So early detection is extremely important. And why does early detection not happen in many places, like in Maldives, also in India, is because of lack of awareness. Women feel shy to talk about any problems in the breast, or there is plain lack of awareness, not even knowing that something that is growing in the breast could be a cancerous lump. So, dear friends, it's important to understand what are the signs and symptoms of breast cancer. It can start as a lump or a swelling or a mass in the breast or in the underarm region. And many times this lump could be painless to begin with. There may be no pain associated. And that could be confusing for women, thinking that since there is no pain, there is no urgency to see the doctor. So if you find any of a lump in the breast, whether painful or painless, do take medical help and understand what the problem is. Second symptom to remember is that there could be some skin changes. Normally the skin over the breast or in the underarm region is very smooth, but it can change. It may seem as if it is pulled inside, or there could be rashes or change in color. And thirdly, important to know that there could be some nipple changes. Normally the nipples are pointing outwards, but it can change. It can become distorted, or sometimes it can become inverted. That means it has gone inside. So if you find any of these symptoms, please do not panic, but do not waste time and go and seek medical help. And that's extremely important. As I said, early detection is the game changer as far as breast cancer is concerned. We have been privileged to treat a lot of Maldivian patients with breast cancer. and many women related cancers. And why I think that breast cancer is treatable, because thanks to the advanced technology, there has been so much advancement in breast cancer treatment that most of the women who have this disease can do extremely well if they are treated appropriately. Should I keep it back? So breast cancer also has many, many types. So there is no one treatment which will fit all the patients. And today is the era of precision medicine. That means each patient, we study what is the type of the disease and what is the most suitable treatment for them. Now, one of the fears, in my experience of more than 20 years, I see that one of the fears that women have is that if I am detected with breast cancer, my breast would be removed, my femininity or womanhood would be lost. No, dear friends, that is not true. We do advanced surgical techniques like breast conservation surgery, oncoplastic and reconstructive surgeries, and now we have started robotic nipple sparing mastectomy, wherein the idea is to not only clear cancer but also give good quality of life to the women after cancer treatment, because the survival rates are very, very high after breast cancer treatment. Hence, equal importance needs to be given for the quality of life. Now, in robotic nipple sparing mastectomy, a very, very small cut is made not on the breast but at the side near the underarm region, and this scar is almost invisible. And through this small opening, we introduce the robotic arms. We safeguard the skin and the nipple of the patient which is healthy, and remove the breast from inside and replace it with an implant, and all of this happens in a small cut which is about 3.5 to 4 centimeters, which is almost invisible. In Apollo Hospital, Bangalore, India, we also have a comprehensive breast cancer unit, is what I would say. Now, breast cancer treatment is a teamwork. It is not that only a surgeon can treat. There are many, many specialists who are involved in treating a patient, and all of these are available right from diagnostics to the precision oncology. We have all the facilities available in Apollo Cancer Center, and we do analyze our data, and we are extremely proud to say that our outcomes are as at par with any of the centers, best of the best centers around the world. And our survival rates are extremely high, and they are at par with any other center in the world. Now, talking about some of the other cancers which occur in women, that is cervical cancer is also a very commonly seen disease in Maldivian women. Cervical cancer also is very easily detectable. Early detection is possible by doing what are called as pap smear tests. There are many different treatment modalities available, including surgery and very precise radiation therapy, as Dr. Sridhar has already mentioned. What we call as brachytherapy is available. Also, human papilloma virus, the HPV vaccine, is available in younger women, in younger children, and when it is given, the risk of cervical cancer can considerably be reduced. Also, one of the problems which I understand in Maldivian women is endometriosis. Now, what is endometriosis? Endometriosis is something wherein the menstrual blood which a woman experiences monthly, the menstrual blood which normally comes out through the vagina, can go in the reverse direction and through what are called as fallopian tubes get lodged in the peritoneum or within the abdomen. And this can cause a lot of scar tissue, and it can cause extreme pain in women. There are many treatment modalities. Not only is pain a problem, but one of the major issues that it can cause is infertility. The infertility rate can go high in a woman who has endometriosis. There are different ways of diagnosing it by doing ultrasound or transvaginal ultrasound, sometimes MRI, and also laparoscopic surgeries. So overall, I would like to say that prevention is certainly better. Eat healthy, have a child before the age of 30 years, breastfeed your children for as long as possible. And if you have a family history of breast or ovarian cancer, there are certain tests, what is called as a genetic test, which is a simple blood test through which we can actually know if the woman who has developed breast cancer has inherited an abnormal gene which is transmitted in their family from one generation to another. And if such kind of a gene is detected in a woman, in these women, then there are certain risk reduction surgeries or risk reduction medications which can be given, which is called as chemoprevention, and we can reduce the risk of cancer happening in these women. So women, please do take care of your health, and because women's health is a prime importance not only for the family but also for the entire society. And we at Apollo Hospital are very happy to support you in any way through your medical treatment. If any, I know the distance would be long, but we are also available for video consultation for initial workup, and then if required, a trip could be made to Bangalore, that is India, at Apollo Hospital, and we will be very happy to support you. Thank you very much.
Thank you, ma'am. Thank you so much. Now I invite Dr. Praneeth to speak on heart care management and preventive medicine.
Good morning, Maldives. I am Dr. Praneeth, consultant cardiologist. I think till now, we have discussed a lot about oncology, but cardiology-related diseases are the most common that is there once our population gets aged. Like all over the world, once people are living longer than 50 years, then we start seeing more and more cardiac issues and more oncological issues also. 1/3 of the people are suffering with the cardiac issues which need an urgent attention, and we need prevention from the diseases. Because the cardiac diseases comes as like a thunderbolt where we don't have a lot of time, because it becomes like an emergencies which are life-threatening. So it is very important to prevent these cardiac issues and also identify them much earlier such that they will never convert into a cardiac emergencies. In that, I think Apollo is in the forefront in treating cardiac diseases and managing them so effectively such that they will never become a cardiac emergencies. If we see, cardiology is now progressing so well that now we are going into so precision that we are able to just peep into the cardiac vessels and identify what is happening at a molecular level and treating them more precisely. It's not just an angioplasty, it's about a intravascular imaging driven angioplasty. Right now, the AI-driven intravascular imaging is the new one which we are started from a few months, where we are exactly assessing the size of the blood vessels and treating them so precisely that there won't be any emergency down the line in future once we address them with the precision therapies. That is one thing. Second, coming to the structural diseases, that means related to the so many walls and everything. Previously, it used to be more invasive surgeries. Now they are becoming much smaller incision, and it is done through a small tube and replacing the valves. Third one being is related to the irregular heartbeat. As already Dr. Satish has discussed about it, arrhythmias. It is irregular beats that are, it is commonly seen in Maldivian patients that we are seeing from past decade, where the irregular heartbeat is the one which affects the heart suddenly, leading to so many complications. So we have an advanced electrophysiological lab which can identify these problems and precisely modify these electrical wires of the heart such that these irregular beats won't happen. So these are the 3 most common diseases that are seen in Maldivian patients. And also the advanced pacemakers and cardiac resynchronization therapies that are available that we are most commonly doing in Maldivian patients. So it is very important for the people to be aware of these diseases and seek the care much earlier such that it won't lead to an emergencies. Thank you, Maldivian people, for giving this opportunity. Over to Dabu. Thank you.
Thank you so much, sir. Now I open the forum for question and answers.
Please.
My name is Matlub from State Media, PSM, right? So you guys mentioned a lot about different fields and that how you treat. And I would also, she mentioned that telemedicine is also available since it's a very long distance to travel and people actually do need beforehand to know what they are seeking, right? So how should one approach you for this kind of service beforehand, and what are the requirements you would need before, so that the patient, you can treat and diagnose actually what the patient needs?
Yeah. So should I answer that?
Yeah, please.
So video consultation is extremely convenient, but it has its own limitations, all right? But I always encourage that not only for out-of-country patients from India, but also within India is a large country where traveling may be an issue. So initially, if there are any symptoms and if you would like to have a video consultation and how to log into that portal, I think Abu will help us in understanding that. But we could at least speak to the patient, we could understand what the problem is, we could suggest certain tests which can be done locally, and they can share the reports with us. And with that, if we feel something is where they really need to travel, yes, we would do that. But we all should understand that on a video consultation, we do not actually examine the patient. So we cannot diagnose only through the reports that we have or through the investigations that we do, but physically examining the patient is also equally important. But at least for the patients who have been treated already by us and they need to have a follow-up regularly, yes, video consultation is possible, and we are doing it for a lot of Maldivian patients already. We could also extend it for pre-diagnosis, whatever locally can be done. And there are many smaller issues which can be resolved over the telephone and or video consultation, which could be possible. And we would certainly welcome and encourage that.
So that's a very good question, and it's practically everywhere that's the same problem. So even in part of India, that's one of the things what we face. Accessibility and affordability is the key factor in any healthcare. So how to bridge that gap is one of the main questions. So I always insist you have your own doctors community which is there, with all due respect to them. So please, they should be the first persons to have a look. In case, I know that in Maldives is the many islands. So as Madam rightly said, at least like what we do it is, we also take care of the other parts of the world, a lot of African patients and other, even Middle East. Every Friday, so we have one we'll give a video consultation, like online consultation possible. So only thing is you may have to upload the image, the clinical details, and to our system, so that we can have the appointment and take it forward. I am sure the two factors which is very important. None of the patients come online for an emergency situation. So emergency situation has to be handled locally, at least to go to a local doctor, and that will be taken care. And if the things can be done here as a part of the investigations, and I prefer to get all the things to be done here. Only when it is required, which is not possible to treat under here, is the one what we are really looking at that. We can talk to the doctors, we can talk to the patient directly, and that's one way of looking at. Emergencies managed here, the rest of the things can be done. Then comes the follow-ups of the patients where we are giving. We are going to come regularly in the different specialities. If it is required, if it is depending on the requirement, we can make a camps also. That is not it is very much possible. So the online consultations, meeting with the particular doctor is part of it, is absolutely fine, and we are open for both of the things. So, lot of times when we talk about camps and these type of things, the patients start just waiting for that. So that should not happen in any of the medical field. So they have, the moment if they find something, they have to meet the local doctor and concerned persons to make it possible. Anybody wants to add?
Yeah.
I hope you got the answer.
Even in cardiology also, the newer pacemaker and everything is all are Bluetooth enabled, where you can send the entire data without coming to the hospital, where you can transfer the thing to us directly through our mails, and we can have a video consultation afterwards to understand various irregular beats and everything.
You know, this is the practice, we have been following at Apollo hospitals, because we get patients from 121 countries. So the protocols are set. So most of the international patients, post-op care, they get in touch with the doctors, and we continue to give that care. And whenever we travel to those countries, we try to organize, the screening camps for those treated patients. And the patients, who requires medical treatment, medical attention, those patients will also come and see us. And likewise, we have been working with a lot of public domains across the globe. And there is a set protocol for all international patients, and also there is a international patient services team in all the hospitals to take care of them from end to end. Thank you.
So far as neurosciences is concerned, we are actually very happy to note that a lot of advancements have happened locally in Maldives as well. We understand it's a small nation. It is probably as big as one of our smaller cities. So because of the limitation of the size and the population, every possible facility cannot be made possible, because it doesn't work out in terms of economies of scale. So the basic investigations, like for a brain tumor, for example, would be a CT scan of the brain or an MRI of the brain. And these are generally available even locally in Maldives. Now, simple things obviously can be taken care of in the local setting itself, but when it involves the use of little advanced technology, which may be little difficult to get locally, that is when the patients have to travel, whether it be the platforms like CyberKnife, etc., or intraoperatively also we use a lot of advanced technology. For example, in deep-seated brain tumors, we have to use a technology called as neuronavigation, and we have to actually track all the important structures in the brain. Obviously, all of you understand everything in the brain is important, but certain areas and certain structures are extremely more important. So by doing what is known as preoperative 3 Tesla MRI with image tracking of the tracts, it is possible to define the relationship of the tumor or the lesion of interest to do the surgery safely with a safe trajectory. So to plan this, a lot of technology and as well as experienced personnel is a must. And we are happy to say that in Apollo Hospitals, Banerghatta Road, because this is going on everyday basis, we are very comfortable in dealing with such situations. As to the logistics of reaching the hospital itself is concerned, as we understand, and we have traveled extensively to Maldives, it's just a 2-hour flight from Maldives, and now we have more than one option to travel directly to Bangalore. And mostly the Department of International Patient Services, led by Abu, they take care of the patients from the time they land in the airport to the time they actually are picked up from there, and to the time they actually are dropped back to the airport. Everything is taken care of as a seamless way. The patients do have an experience which normally brings out a lot of anxiety in terms of language, culture, food, etc. So a lot of these things we take care, because as Abu mentioned, it's not just Maldives but more than 100 countries where the patients have been traveling. The similar treatment in Western setting will probably cost something like 1:20 or 25 times more. So having a same technology platform and experienced doctors treating at a fraction of the cost of the Western medicine is what is the attractiveness of traveling to India, and especially to Bangalore. Thank you. Want to add something, please?
So, I was the awareness, like what are the, in medicine is actually time is the key and awareness is the key. As a part of the media, so the importance of the awareness and is especially the part of the media. Media should make the people aware what are the things to be seen for a particular things. It may be cardiology or neurology or neurosciences or oncology. When the patient should approach, if they don't know about that, making that awareness is very key factor for any healthcare sector. And media plays a major role. Since we are planning to come regularly, like we can always, as a specialties, we can give a health talk for that, what all the things to be looked for, and do's and don'ts, so that the people will be aware of it. Thank you.
I think, thank you so much, all of you, and let's look forward for a better tomorrow. Thank you so much.
Thank you.
Thank you.
Thank you very much.
Thank you very much.
Thank you.
Thank you.